I've spoken with my beautiful teacher, and I thought, I have never considered myself being on the front line when it comes to this pandemic, because I'm not in a hospital treating, massive amount of people being sick on ventilators, seeing the unseen and unspoken, and it's just like, can't even imagine that. And I know I made a video about that, and just my heart goes out to everybody, and my deep gratitude goes out to everybody who has been doing that for so many months now, more so now sometimes than ever. And I had a share from the same patient with his wife that was, as he was driving to the office, there was a nurse sharing on, I think it was a PD podcast he was listening to, and she said that they are protesting the hospital administration against being forced to get vaccinated in order to work at the hospital, because saying everybody is seeing what we are witnessing here with patients coming in sick after the vaccinations, and you cannot ask us to get vaccinated. You cannot ask us to get vaccinated after we're witnessing what we're witnessing. And again, once again, a profound truth being spoken, and hopefully it'll be heard. But what I realized, there's a front line that's a front line, and then there's a front line that's a back line, for lack of better words. And what that is all the physicians and other health practitioners and anybody, nurse practitioners, you name it, seeing what I'm seeing, which is patients struggling with still post-COVID symptoms, unable to find treatment, or not given the treatment available to them to help them deal with and support the immune system to finally eliminate and get rid of the virus, and support the inflammatory process in the body that's still going on, and or vice versa. I'm seeing so many people now with their high hopes going to get vaccinated, and then they're getting worse or getting symptoms that are just lingering, and nobody can do anything for them, like IgA vasculitis, just okay, let's just wait and see. It's not so. It's like a different front line, and what I mean by that, I just want to honor everyone going through that. And I believe that it's something to be spoken about, because what it does, it creates a chronic high level of stress on the mental emotional field of our organism. Like for me, what it is I haven't really kind of honored that until recently. It's like, I'm not really at the front line, I'm not the one to go home, have to take off all my gear, wash all the laundry, shower everything, not see my family. But this is more like a chronic kind of gaping wound, where I see the hurt being done, and the people struggling and losing hope, and being, literally like, I don't know what I'm gonna do. Like, am I gonna get better? And it's like, for me, knowing that something else could have been done right off the bat, or knowing that, there's more available than the vaccine if we really look at the big picture, and then having to see like, oh my gosh, like all these things have to be done now to even support them going forward. So it's like it can be easy to get into this hopeless place. So what I have noticed that I want to share with anybody who is in any way remotely affected by this, whether it's your significant other that's in that same healthcare position, or you're in, or whether you go to your physician and sometimes they are not really sure what they need to do right now, so they decide to only see vaccinated patients because there's so much high stress on them that they are just making decisions that's the easiest for them, and for their staff. is because the level of stress and pressure in the medical field and the level of unknown has been so vast. What happens oftentimes, we have to push it push it away in order to go and do and see the patients and do the work that I need to do. Is if I'm not conscious, I kind of have to go, okay, there's this big cloud of pain and, in a way, trauma of humanity, really, but I'm not able to deal with that right now, and I don't even know. Let's just leave it and do. But it builds up and it piles up if we don't consciously address this, or at least where I go, okay, wait a minute, there's this high level of stress, anxiety, like I have to really honor that, and I have to show up with more compassion for myself and then for others and the decisions that others are making, whether they're physicians or whether there are patients, and then respect that, because understanding that they are influenced by this big, energetic, unknown stress field, and just absolutely do the best I can to stay present, just like with the sunset. That's what happens for me every day. Just like stay present and realize that I'm doing my best, the best that I can, and so is everybody else, and I'm not the one to judge anybody else's. All I can be is inspire people to follow their inner guidance and their empowerment and speak their truth and stand for it from a place of love and compassion. And if they're not able to understand that they are just simply not able to, and if they react and get upset, can I stay in my truth and my compassion and understand that they're going through something right now, because the level of stress is almost like, we have had stress as a humanity, and then it went up to like massive, COVID pandemic. It's kind of calming down, but it's becoming to be more chronic in a whole different way. That's more difficult to kind of put a finger on. So I just want to encourage us to understand it's there, see it for what it is, and be there, the more present with ourselves, which will really help in the big picture. It's like these anchors, like if you have like this big storm, there's like the anchor in the middle of the storm. So almost like, can I be that? So that's what I'll leave you with for today. We had a beautiful sunset. Thank you so much for sharing, and I will see you tomorrow. Take care. Good night.